Here we go. Welcome, everyone. We're just going to give a second so everyone can get signed on, and then we're going to get started. My name is Kay Huff, and I will be your Benco host tonight. I definitely want to take a moment while everyone's getting signed on to thank all of our Benco customers for coming on our webinars, and also all of our associates for help getting the information to all of our Benco customers. We really have enjoyed these webinars, and we really want to continue to move forward with them. So thank you so much for joining us. So with that being said, I definitely don't want to hold up. So we are going to be giving CEs for this. So let me just go over the CE guidelines really quickly. Number one, please make sure you signed on with your legal name, because your certificate's going to come back in whatever name you signed in on. So it's important that you use the name that's on your license. Each person registered, if you're wanting CEs, you must sign on your own computer or device. That's really important. That way our CE department will be able to see that you're on. You, if for some reason you are signing in on your cell phone, if you're using the link, that's perfectly fine. However, if you're dialing in, we will not be able to see that. So we're going to ask that you please send us your name, the title of today's course, and your telephone number to practicecoaching@benco.com. And don't worry, I will give you that email again at the end. But again, it's practicecoaching@benco.com. It is important that you stay on for the complete hour in order to receive the CE. That's super important. And then also, we will be sending you out a survey at the end. Please let us know how we're doing. And also, if there's any suggestions about upcoming webinars that you would like to see, please let us know. We'd definitely like to provide those for you. Also, at the very bottom, you're going to see a Q&A. Leslie definitely wants to answer your questions throughout this webinar. I know that we may have a lot of them. So please make sure that you put your questions in the Q&A, and Leslie will take breaks at different times during the program, and we'll do our best to make sure that we answer all of those questions. However, if we don't get to all those questions, don't worry. Leslie will answer them, and then we will send everyone who's attending tonight's webinar a copy of the Q&A so that everyone will be able to get that information. So with that being said, I'm super excited. This is my best part, of course. I'm always excited to introduce my amazing boss and the managing director of Benco Dental, Chuck Cohen. Take it away, Chuck.
Thank you very much, Kay. I appreciate that. So I've done a bunch of these webinars. Maybe some of you on tonight have seen other ones. I'm very excited to report this evening that I have a new camera. So it's a very high def camera, and this is the first day that I'm using it, and it just makes my forehead look bigger and shinier. So I'm practicing along here. That picture that you see here on the left is an older picture, and I just can't help. I just need more hair up here. It's all good. Anyway, welcome this evening. We're glad you're here. Thank you very much to Kay, and our star of the evening, of course, is Leslie Cannon. We'll get to her in a minute. My job is to say thank you very much for being here. Leslie, I think this is the third program that we've done together since COVID hit. One has been better than the next, so thank you very much for being here tonight. Before we start your part of the presentation, your ask was that I would give the supplier perspective on some of the PPE shortages that we have. So that's what I'd like to do first, and then I'll turn things over to Leslie for a more global perspective. So the first thing is the mask shortage is getting better. We are getting better supplies of masks, especially N95s. We encourage everyone to put their orders through, and we're going to fill them as they come. But the supply chain is getting better on masks in general. So that's the first thing. Second thing is we are seeing some indications that there might be a shortage down the road for gloves. So we are putting gloves on ration in our organization. And so we are filling orders, but we're not filling orders for as much inventory as people may want at a given time. So I would encourage everybody to not hoard, because hoarding is always a problem, but just to make sure you're ordering gloves regularly. Pick a supplier, whether it's Benco or another one, that will make sure that they assure you that over time they're going to make sure to manage the supply chain smoothly so that nobody runs out. So we are anticipating that there may be some different periods of time where we may have trouble getting product. However, by rationing product today, that means tomorrow we can have what you need when you need it. And then the third one, the one that's causing the most stress these days, is the disposable wipes. disinfectant wipes. The problem, in case you haven't heard, is not the chemical itself. The chemicals are fine, they're very available. The problem is what's called the substrate, or the actual fabric that's used to make the wipe itself. That's because if you look at Clorox or over-the-counter products, they use the same different fabric kind of product. The chemical in the product itself is different. But because of the high demand for the fabric, it's very difficult for us to get, or anyone in medical, to get the disinfectant wipes that you like. I get that. The good news is that the chemicals themselves are absolutely available. We have no trouble getting them, but in spray bottles. So Leslie will talk this evening about why it might be a good time to use the same chemical that you're used to using, but use a different delivery system, whether it's a towel or some sort of a wipe, while temporarily we have trouble getting the disinfectant wipes all in one jar as they used to come before. That's pretty much oh, one more thing to report. Good news, we're pretty much not having any trouble with gowns anymore. The gown supply is filled in. So if you decide you want to use gowns in your practice, you should have no trouble getting them. We have them, others have them as well. So whereas in the beginning of the COVID situation, gowns were hard to get, now gowns are very good. So a little bit of an issue around gloves, still some issues around masks, but getting better. We don't know when the disinfectant wipe issue is going to go away, but we do have a solution, and the solution is the same chemical, but in a spray bottle, and no trouble getting. That's the quick overview where we stand today as of the end of October. As always, we do appreciate your business, and thank you very much for giving us the chance to supply you. And I think you get a similar story, whether it's Benco or Shine or Patterson, any of the established, well-known dealers, where you can trust them and they can trust you, and all good from there. So with that, I would like to turn it over to one of my favorite people, the expert on infection control in the dental practice, Leslie Canham. She's been around a long time, long enough as I have to remember the bloodborne pathogen days, right? So we remember HIV and bloodborne pathogens. Now I feel like this is our second crisis together, airborne pathogens. Leslie's going to walk us through tonight some more ins and outs of the PPE and the infection control and what you can look forward to. So Leslie, thank you for being here this evening. Have a great evening, everybody, and enjoy.
Thank you so much, Chuck. I appreciate all the information that you've given us, and it certainly is encouraging to hear that we are able to get gowns again and there are solutions available. Thank you. Very quickly, I just want to provide a quick disclosure that I am a Benco Success Partner. I provide OSHA infection control and HIPAA training. And tonight, our objectives are to really look closely at how to determine what the best PPE is. What are we going to select for the particular task in a dental setting? How to use disinfectants properly and what to avoid. We don't want to make mistakes. We don't want to jeopardize patient safety. And how to reliably find resources for infection control. There's so much information out there. Some of it is not accurate, and so we don't want to fall prey to any of the myths and missteps in infection control. Now that we have COVID-19, which is actually the disease, coronavirus, the virus itself is SARS-CoV-2. And there's actually was a first iteration of SARS, that's severe acute respiratory syndrome. You might remember it back in 2002, where SARS was prevalent in Asia and made its way to Toronto, and we had a few cases in the United States. Well, that was really probably one of the first, I think, exposure to coronavirus that I had experience with, as far as knowing that there was such a thing as coronavirus. There's approximately 7 different strains that we've experienced of coronavirus. And as I attended a webinar the other day, I was surprised to find out there's actually DNA-wise about 890 different coronavirus strains. But the SARS-CoV-2 is for coronavirus. CoV is coronavirus, and then 2, it's the second one, it's not the first SARS. So coronavirus is actually really the disease is COVID-19, where the virus is SARS-CoV-2. And in trying to make sure that we get the information that we need, that there's help, there's support, there's advice and guidance. You can get these resources a number of different places. I want to make sure that you have those resources available to you and that they're trusted resources. When you get your CE certificate, you're going to get a PDF from me that has a variety of resources, such as the OSAP DentaQuest COVID-19 infection control practices during pandemic. There's also the CDC guidelines, not only the most current ones for COVID-19, but also there are guidelines that are the tried and true guidelines from 2003, 2008, and 2016. The EPA website directs us to disinfectants that are known to be effective against SARS coronavirus. And then there's also some great resources by dental associations. So I would love for you to be able to access those best resources. And I've been chasing COVID-19 since I first heard about it back in December of 2019. I heard about the coronavirus. It was an outbreak at that time, and then it became endemic and then pandemic. And so I have been collecting resources that are available, and you'll get a PDF that has all these different links that you can click on so that you can actually get to the resources that I get to. Now, most of you are likely familiar with the CDC guidelines. The most current version for interim infection control guidance during COVID-19 response was updated on August 28th. Now, if you had originally downloaded either the June 17th or the July version or the earlier August version, you don't have the most current information. And because we're learning more and more about this virus every day, it's important that somebody in the practice stay closely connected to the CDC website for the most current information for us in dentistry. So I'm going to tell you, actually going to show you the steps of how to get to the document that you see on your screen right now. You go to cdc.gov, and likely the top hit is going to be COVID-19 resources. So if it's not, you can put in the search bar COVID-19. Now, once you get to CDC, it's just www.cdc.gov, and then you get to the COVID-19 homepage. What you do then is scroll about halfway down and look for the section that's called Healthcare Professionals. Click on that. Then scroll about halfway down again and click on the word infection control. And then when you get to that page, scroll about halfway down again. And when you see the word dental settings, that's where you want to go, because they have infection control for nursing homes, for ambulatory facilities, and we want the one for dental settings. That applies to us. So that's going to be the number one resource for you to stay closely connected with, because it updates frequently. And I'm kind of surprised here it is October and we haven't had an update since August 28th. Now, there was one update that was on the CDC website. You might have heard that on September 18th, there was a publication that CDC posted about how SARS or how COVID-19 is transmitted and how it's spread. And there was a good deal of information about aerosols, which we know all about in dentistry. But for some reason, that website page was pulled down, and Dr. Redfield, the head of CDC, said it was a mistake that it was published, that it was not ready, it was a draft form, and it wasn't supposed to be published yet. But in any case, in October, they went ahead and posted the most current version of it, and it does recognize that aerosols are a form of transmission, but they reverted back to the close contact with other people being the primary mode of transmission. Now, another fantastic document for you is the OSAP DentaQuest Best Practices for Infection Control in Dental Clinics during COVID-19 pandemic. I actually helped create some content for this document, and it's a living document. So there's a link in my PDF that I'm sending to you that will have the exact link to this particular publication. I don't recommend that you print it out. Now there are pages, maybe some checklists that you might want to print out, but it's a living document on the internet. And as things change, this document is updated as well. So you'll find fantastic information from disinfectants to PPE to waterline disinfection, and every single link, there's a spot where you can go further for more information or for some practical tips. OSAP is the Organization for Safety, Asepsis, and Prevention, and they are dentistry's #1 resource for infection control. Now, moving a little bit further for other resources, you can stay closely connected to the American Dental Association website. They've got the COVID-19 resource page, and that was actually published and updated multiple times, again, to reflect some of the changes in infection control. And there's some great tools and checklists that you can use for making sure that your practice is fully compliant with infection control protocols as recommended by CDC. For those of you who are in California, California Dental Association has just done a killer job of a document that is almost identical to the American Dental Association Back to Practice website resources. However, their resources are really more in depth. And for those in California, it really does play nicely to California regulations. But if you're not from California and you're not even a California Dental Association member, you can log on to the CDA website, cda.org, and go to the Back to Practice resources. There's PowerPoints, there's checklists for you, all sorts of good information that will help you reaffirm that you're doing all the right things when it comes to infection control and safety. Our tried and true resources relate to the CDC guidelines that are specifically dedicated for healthcare settings or dentistry. The 2003 guidelines are the guidelines that are referred to when it comes to disinfection of treatment rooms and for other environmental surfaces. The 2008 guidelines are for healthcare settings. They were updated last year on sterilization and disinfection. So there's a small segment in that document that relates to dentistry. And then there's the 2016 checklist, which is a checklist called Infection Prevention Checklist for Dental Settings, Basic Expectations for Safe Dental Care. You can get it or asking CDC to mail it to you. You can download it to your computer. But my favorite way of making this document accessible at my fingertips, I can actually get this document on my cell phone. I can download it. There's an app, whether you have an Android or whether you have an Apple device, you can download the full document. And again, it has clickable links, just like the OSAP DentaQuest document, that give you more expanded information on each point. I actually take this document with me when I conduct audits at dental offices or when I'm investigating breaches in infection control, because it helps me go through each one of the areas that CDC recommends and that OSHA requires to make sure that a dental practice is adhering to safety and infection control precautions. Now, speaking of OSHA, let's just take a look now at the OSHA website that is dedicated to the COVID pandemic. They updated this in April, and you'll notice that it says dentistry workers and employers. I don't love the grammar that they use in this document. There's actually, I have 3 slides that show you important aspects of this particular document. But I do want to just for a moment, besides introduce you to the interim guidance for dentists from OSHA, I wanted you to take a look at the picture that is here on the screen. Just think to yourself, what is wrong with this picture? You see 2 dental professionals working over a patient, but something's missing. If you said they are not wearing clinical jackets, you would be correct. OSHA is the one that requires us to wear long sleeves, so clinical jacket or PPE. And in both of these individuals, there's no clinical jacket. So I thought that was kind of ironic that they chose that picture to use on their website. There's another document that OSHA published for all businesses, and it's called OSHA Guidance for COVID-19, and it's preparing workplaces. This is a document. It is similar to, if you remember swine flu, we had the swine flu outbreak back in 2009. They issued guidance at that time too. And in fact, I thought that OSHA did a phenomenal job, as well as CDC, informing the general public on what steps we would take to protect ourselves. So when you think back to 2009, the swine flu pandemic did hit us, and we were concerned. We had guidance. Even American Dental Association issued guidance to dental practices to to screen patients at that time, and to remind employees not to come to work if they were sick, and of course cough etiquette, and making sure that you get vaccinated for influenza, all of the smart things that we're supposed to do. And I remember back in 2009, there was a lot of information, a lot of public service announcements on using hand hygiene and not coughing into your hands, coughing into the crook of your arm instead. And that's where I started to see public places, not just healthcare facilities, but all sorts of places have the hand sanitizer, the freestanding stand, and with the tissue that you could get tissue if you needed to cough or sneeze into that, and reminders to wash hands frequently. So we did a good job back then. That here in 2020, OSHA has deemed dental professionals to be at very high risk for exposure to COVID-19. So actually, again, remember, COVID-19 is a disease, the SARS-CoV-2 is the virus. So most people recognize COVID-19 when we talk about it that way. So COVID-19 or coronavirus or SARS-CoV-2 is spread by close person-to-person contact within about 6 feet of one another. And that's what information that is is on the news and throughout media. Everybody knows that the 6 feet is how far we should distance from one another. And to take it a step further, droplets from a cough or a sneeze that get into your mouth or your nose or your lungs can actually bring the virus in. And the interesting thing about SARS-CoV-2 or coronavirus is that it has these little like spikes that attach nicely inside your body. So they hang on, and your nose, mouth, your lungs, that's the area that the virus likes to really first anchor itself into your body. Now, aerosols, this is the part here. So droplets are one thing. Aerosols were droplets, but the moisture has evaporated, and aerosols can be generated when you're breathing. They can be generated when you're talking, singing, shouting, yelling. That can actually send aerosols quite a distance. The interesting thing about aerosols is that they can remain airborne for about 3 hours at a time. As we're learning more and more about coronavirus, we're finding out that we may find that it's visible or not visible, but it's present on surfaces for long periods of the time. And we're finding out more and more about the symptoms that individuals might experience if they are infected with COVID-19, and also the symptoms that they might have after they've been infected but have recovered, the lingering symptoms. So in protecting ourselves in dentistry, and of course in public too, we want to avoid close person-to-person contact, but 6 feet might not be enough. The Journal of American Medical Association, JAMA, published back in April that sneeze droplets of all sizes can travel 23 to 27 feet. So this picture here shows the turbulent gas cloud from a human sneeze. It would be a very wise idea in your practice setting to have the sneeze shields, just like the kind of partitions that you see at the supermarket these days or at other businesses. Remember that if other businesses have them and they're not healthcare providers, and we don't have them, and we are healthcare providers, what kind of message is that sending to our patient? So please don't feel bad about having that sneeze guard at your reception desk or in other places, maybe partitions between patients in open bay style treatment area. So know that this is what your patients are seeing in other places where they go. We can't get away from generating aerosols in dentistry. when we use a handpiece, we have to cool the burr. Ultrasonic scalers are a very important part of a dental hygienist toolkit. And in some cases, hand scaling just doesn't do as good a job as an ultrasonic scaler. Air and water syringe. When we use the air and water syringe with both buttons pressed down, we generate aerosols. In fact, when you blow a gentle puff of air on a tooth, which is frequently done to dry the tooth off, so the dentist or the hygienist might be able to get a better view of the area that they need to work on, that would displace what's in the patient's oral cavity and it aerosolizes out. You're a big piece of real estate when you're in front of your patient, and the aerosols can land on you as well as droplets or spatter. So that means we really need to be mindful of the PPE that we choose and how we wear it, making sure that we choose the right PPE and that we wear it properly. Personal protective attire, and remember, whole world knows what PPE means now. Used to have to explain that. Even in my lectures to dental professionals, it's always, what's PPE? Personal protective equipment. And we call it personal protective attire, personal protective equipment. And that includes protective eyewear. CDC and OSHA are now saying not protective eyewear by itself, but face shield or goggles. Goggles seem to be something new introduced as far as what we had been used to wearing. We wear face shields, many of us do, but a lot of us have either loops or have protective eyewear. They call them trauma glasses. Okay, so I'm going to move into protective eyewear in a minute, but I want to just go through the surgical face mask is what we've been used to, but now we are finding a need for better respiratory protection. So that would be an N95 respirator, and we'll talk about some of the alternatives to N95 respirators as we go along. And of course, gloves. Nothing has changed with gloves. We're hoping that we don't see any kind of shortage, but we also want to be prepared in advance. So I understand that there may be some rationing going on. Many times when I visit a dental practice and they're seeing patients, I'm disappointed when I see people wear their own prescription glasses. OSHA doesn't recognize your prescription glasses as being safety eyewear. They are not protective eyewear. They're prescription glasses, unless they are. If they're manufactured with shatter-resistant lenses and they have solid side shields and brow guard and a wide lens, then you can actually have prescription glasses that are manufactured to be safety eyewear as well. But in most cases in dentistry, we have access to protective eyewear and face shields. Now, someone asked a question, do you think if we go back to no shields at the front office, if not, should we close it in and make a window like in the 80s? Oh my gosh, I remember the 80s. We want to open our waiting room. I understand that. Boy, I remember when I worked for my father, who's a dentist, I remember that window that people roll the window open to greet the patient, and then the receptionist would roll it closed, and it was very impersonal. I don't know that I want to go back to that. I kind of like the open reception area, but a sneeze shield is a good guard, and it's clear, and in most cases they're portable, so you can move them away. And as we find our way back to maybe pre-COVID days, we can remove and eliminate them. But I think that at least for the next year or so, we're going to have to be vigilant with our precautions. And someone asked, the other question is, what is the best plan for reopening a waiting room? The best thing is just to make the waiting room a place where people walk from the front door to their back to the treatment area. If you have somebody who's escorted a patient to the office, and they need to wait in the reception room, perhaps you can stage your furniture so that it's 6 feet apart. I know in many cases I visit dental practices, they still have their reception room furniture, but they might have thinned it out, or in some cases they'll turn some of the chairs around toward the wall so that don't sit here. It's fairly obvious. And so at this point in time, again, I would still watch the indicators and the community spread, and continue to just use your reception area as minimally as you possibly can. Well, I'm going to get back to the face shield and the protective eyewear. I want to also caution you against using a face shield upside down. A number of folks tell me that, gee, well, that works really well as a sneeze shield. Maggie is demonstrating a sneeze shield that she got from a company called Z Shield. And it's actually like an inverted face shield. So the part that you normally wear on your forehead, like a visor, is down here around her neck. And then the shield goes up like this. Well, that's great for protecting her face from what she's exposed to as far as droplets or spatters, but it doesn't do a thing for what comes in over the top, the aerosols and droplets that might land on her or that might come in the area of her eyes or her nose or mouth. And so this is not authorized for medical use. I would encourage you not to use something like this unless you also have a face shield over the top, maybe a disposable face shield, and then this as a splash or a sneeze shield, if you will. Moving on a little bit more about the glasses, we have what we call trauma glasses. You can see the nurse that's there on one side there. She's wearing what's called trauma glasses. And trauma glasses, actually OSHA saying, and CDC as well, goggles so that we're protecting the mucous membranes of our eyeballs from aerosols. Your eyes are a wonderful portal of entry to your body. So eyeballs being protected, and then or a face shield. Now a face shield, again, the type of face shield that we are used to seeing, either disposable or reusable, that would be ideal for you. And now, as far as the gowns go, for aerosol generating procedures, use NIOSH-approved or equivalent respirators. But for aerosol generating procedures, a clinical jacket that just covers you at hip level is not providing as much protection as a full gown, as you see here in the picture. So the guidance here from CDC is actually a poster that you can print out from the CDC website that discusses respirators or surgical face masks, depending on what procedure, and again, also depending on what you can get. The supplies may not be available for you to get respirators. So we'll talk about that in a few minutes as well. But likely this is more your look today for an aerosol generating procedure than what you were wearing before COVID. Donning PPE is important. So you protect yourself and you've covered all of the areas that could possibly cause contamination or infection transmission to you. But equally as important is how you remove your PPE. It's actually probably more important because contaminated PPE can possibly cause infection transmission to you if you doff it in a way where you contaminate yourself. So I highly recommend that you go to the CDC website and print out the little posters. One is on donning PPE properly, and you'd be surprised. You'd think we know how to don PPE the right way. But as you've been out amongst the public, you probably noticed a lot of masks below the nose. I used to see that a lot in dental offices, and it always surprised me that dental professionals would not cover their noses, but it was something that I think people just never really thought about. Well, today in dentistry, we think about that and we do cover our noses when we're working on a patient. But in the public, just when I go out and about, of the people who are wearing masks, about 50% of them are not wearing their mask properly. Now, let me get back to doffing. I'm going to spend a few minutes talking about the proper removal, from removing your gloves properly to making sure that you perform hand hygiene immediately after removing gloves. The clinical jacket or gown, if you are going to be removing that, again, performing hand hygiene or alcohol hand sanitizer after that step. And then when removing your face shield or protective eyewear, and then your mask, making sure that you, again, perform hand hygiene between each of the steps so that you do not contaminate your own skin when you are in the process of doffing. It's something you might want to try as an exercise with your own team to, maybe spend a day and go through your protocols and go through the steps of properly donning and properly doffing PPE. There's a great couple of videos on the CDC website or YouTube. Most of us have access to the internet at the office today. So how to safely put on PPE and how to safely remove PPE. I highly recommend you spend some time with your team. It's like a 3 3-minute video. And I have the link for this video on the handout page that you'll get. People are often concerned and calling me pretty regularly about what if we can't get the right personal protective equipment? Well, it's important to document your efforts. Make sure that you have at least documented the date that you attempted to get your PPE. N95s have been difficult to get. And we want to make sure that we document our efforts in the event that we cannot get them. If we're only able to get level 3 masks, for example, or we're only able to get the foreign-made KN95 respirators, your effort, what steps you took, the date you called your company or you placed your order, the company that you attempted to order from, the result of that call, and then also making sure that you continue to put the effort out to try and get the proper PPE. Now, we have different types of PPE that are heading our way too. So you're going to start seeing what's called more power air purifiers or other types of masks. The one that the lady is wearing on the left there, that's called a Clara mask. And that's something that it doesn't replace an N95 respirator, but it's a different type of air purifier, if you will, and it does fit pretty well around the nose and mouth. I haven't actually seen one, but I've looked at some of the information surrounding it, and it seems to be something that is perhaps what we might see more of in dentistry. There's also other types of PAPRs, like this other Gendix type of PAPR, and there's it's a PAPR where you don't need to wear a face shield because the face shield is built. It looks a little bit like a motorcycle helmet, but you can see in the inside that it has the sleeve that comes around your face and makes a firm fit around your face. So that way you're good source control, as well as having fresh air and air that's filtered so that you can safely and comfortably work on patients. Acquaint yourself with the differences between masks and respirators so that you know. The surgical face mask, there's different levels of masks. Some of them don't actually have a level branded on them. They call this the ASTM, the American Society for Testing and Materials level. They actually submit their mask to this ASTM for the rating, but not all surgical face masks actually do submit to that for the rating. So they're not all rated. Some of them don't actually have that level 1, 2, or 3 rating on the packaging. I'll go through the different levels in a few minutes, but I just wanted to make sure that you know the difference between a surgical face mask and an N95 respirator. There's also the difference between a surgical face mask and what's called an air purifying respirator. Now, an N95 respirator, it's frequently called a filtering face piece respirator, and that's the one that you see most frequently. Below that is a respirator called an elastomeric half face piece and full face piece respirator. These are ones that you might see in maybe a company that does painting autos. You know, they have a paint box that they're inside, and they have to wear this respirator so they're not breathing the paint fumes. And then there's a power air respirator called a PAPR, or the picture that you see at the bottom here, it looks a little bit like a moon suit, and it has flanges that come down below the chin. That's something that I'm finding that many dental professionals are opting for, that they're more comfortable in wearing a PAPR than wearing an N95 respirator. And they have the better, just as good a protection, if not better, and probably more comfortable. When you're wearing an N95 respirator, it has multiple layers of filtration and it seals to your face. And the key factors are that the filtration is actually this kind of charged with these fibers that help to filter out viruses. Now, I attended the OSAP Infection Control Symposium a couple of years ago, and there was somebody that was lecturing who was not a dental professional, but was lecturing on masks and respirators. And he said, your surgical face mask does not protect you from viruses. And I actually got very angry because all of my life, I thought that my surgical face mask was doing a pretty good job of protecting me from bacteria and viruses and mentioned that you wear a mask, of course, you protect your patient, but primarily it's to protect the wearer. Well, I was disappointed and angry that I didn't get the kind of protection that I thought I was getting wearing a surgical face mask. So, for example, if someone has active infectious TB, a surgical face mask isn't going to protect the wearer. They need to wear an N95 respirator or better in order to be protected. So again, there are differences in surgical face mask and N95 respirators. When you are required to wear an N95 respirator, initial fit testing is required. Now, there's been some miscommunication or misunderstanding about respirators. And some folks think that the fit testing requirement has been lifted or waived by OSHA. It hasn't. What has been lifted or waived is what's called the annual fit test. Once a year, if you are required to wear an N95 respirator, once a year, you must have another fit test with that brand of respirator that you're using to make sure there are no changes and that it still seals around your face and protects the wearer. Why go through the trouble and the extra effort and the expense of wearing an N95 respirator if it isn't protecting you? So OSHA says an initial fit test is required. Use only NIOSH certified N95 respirators. Now, during shortages and during what we call crisis capacity, where we're at today with acquiring the proper PPE, the KN95s or the foreign made respirators do have what's called emergency use authorization. But in some states, OSHA doesn't recognize foreign made respirators. They want N95s or better. CDC and OSHA also have strategies for efficient use of N95 respirators, including limited reuse strategy. So back on what OSHA is asking us to do, if you are required to wear an N95 respirator to protect you from a hazard, you must have an initial fit test. Now, initial fit test is on the respirator, the brand, the size that you're going to be using. If you get multiple brands and multiple sizes, you don't know whether the ones that you didn't fit test with are going to protect you. Now, the other part of initial fit testing is what's called a written or in-person medical evaluation. A written evaluation is usually done online. I know that 3M has a written evaluation that a person could take. It's like 10 questions, and it relates to your respiratory health. If you answered any of the questions in a way that raises a red flag, you would not pass the written medical evaluation and would have to see a physician in person for clearance to wear an N95 respirator. Some people who have other underlying conditions, for example, asthma, might not get cleared to wear an N95 respirator. Now, let's say that you've got your N95 respirators and you've gone through fit testing and you're able to get an adequate supply. Make sure that when you don your N95 respirator, every single time you must perform what's called a seal check. Now, a lot of times people confuse a seal check with a initial fit testing. A seal check is to make sure that the respirator, when you either blow out while you're wearing it, that no air is escaping around your face, you don't feel any air getting out, and that when you breathe in, that it makes a seal, that it's a seal around you. And you can actually feel the pressure sort of around your cheeks and around your face. Now, that must be conducted every time you don an N95 respirator. So don't use vented N95s. Vented N95 respirators are not cleared for medical use. In hospitals, they are not allowed because they are not source control. That means that you can exhale, whatever you exhale, the other person is exposed to. Now, in the construction industry, I don't think that the car minds if the person painting the car gets exhaled on, they exhale viruses or germs, or on the side of a house painting a house. But so it's for comfort for the wearer, but it doesn't provide source protection. So the N95 respirators are the construction industry kind with the vent should be covered if that's the only kind of N95 that you can get. There's also a number of counterfeit N95 respirators. So be sure that you buy a respirator from a reliable source. You don't want to just maybe go off of Facebook or go off of Google and a company that you've never heard of. These pictures are actually from the CDC website of actual counterfeits. And the way that you would determine that you have a counterfeit, there's no markings on the filtering facepiece respirator. There's no TC number, no NIOSH markings, or NIOSH is spelled incorrectly. The presence of decorative fabric or sequins or add-ons or claims of approval for children. NIOSH does not approve N95 respirators or any type of respiratory protection for children. And also ear loops, that's the other way. It's not an N95 if it has ear loops. It might be a KN95, but N95 respirators have straps. Now, as I mentioned, we are in crisis capacity, and crisis capacity is the capacity where strategies can be used when supplies cannot meet the current demand. And at this point, many dental practices are having difficulty acquiring those N95 respirators. So again, document your efforts to get them, continue to try. If you're unable to get N95s, the KN95s are the next best protection that you can get of a respirator type of device. You can go up to a higher level to respirator pappers, but if you wanted a mask type, and they're not really a mask, they're really a respirator, then a KN95, there's about 80 different brands that have what's called emergency use authorization. Now, we're going to eventually have enough supplies to be able to accommodate the purchase of enough N95 respirators as needed. But then there may be periods of anticipated shortages. Just like Chuck was saying, we anticipate there's going to be a shortage of gloves. So you need to continue to see capacity, our strategy that can be used during anticipated shortages. And then there's conventional capacity where we can get all we want. It may be a higher price than we want to pay, but we can get what we need. I also want to very briefly talk about the strategies for optimizing the supply of N95 respirators. You might have heard of what's called limited reuse strategy. Now, the limited reuse strategy is a strategy that can be used where your N95 respirator can be reused at another time. N95s are single-use disposable items. The manufacturer does not give you any instructions on reusing it because it's not supposed to be reused for a couple of reasons. First, the cross-contamination issue from patient to patient. But secondly, the respirator can be compromised easily when you remove it. Sometimes the corners can bend, or sometimes the straps stretch out a little bit, and they no longer protect you the way that they originally did on the first use. But in the crisis capacity, there is a strategy where we can let the N95 respirator air off. You know, moisture is a big factor. When you breathe in and out of it, you create a lot of moisture. So airing off, and then also allowing the virus, if you were exposed to COVID-19 or SARS-CoV-2 more correctly, that you allow that to inactivate. The paper bag strategy is one strategy. Let's say that you have 5 respirators that you're allowed to use per week, one for every day of the week. So you use your Monday respirator, and at the end of the day, when you take it off, the strategy is to put it into a paper bag, leave the bag open, don't put it in plastic. It needs to air off, it needs to dry out, and then 5 days later, you could use it again. Or you could say, this is my Monday respirator and I can use it next Monday. As long as it's not compromised, and you'll have to inspect it to make sure it is, you could use it again the following week. And our crisis capacity strategy is that we would be using our respirator likely from patient to patient, the same respirator. Again, it's not ideal. It's not what we would do. It doesn't commensurate with our usual standard of infection control protocols. But again, we need to make sure that we have what we can protect ourselves with. Now, I like this idea. Rather than a paper bag, if you have one of these plastic food containers, this is a disposable one, and I cut little holes in here, just drilled little holes in here. So what I could do is when I take off my respirator at the end of the day on Monday, instead of taking it off with my hands, I'll put this over my face, over the respirator, and I'll pull the first strap over, and then pull the second strap over, and then here's my respirator. I'll put the straps inside and then put the lid on it, which has the holes on it, and it has my name on it. And there it is. It can sit, rather than a paper bag, I might have one of these for each day of the week. And that's what I'm going to do to store my N95 until next Monday. Now, again, we're going to hopefully get beyond this crisis capacity level and be able to have enough N95s. The assumption is that you can don and doff an N95 respirator approximately 5 times. And again, that's not manufacturer's instructions, that's just the theory. So if you put it on Monday morning, you take it off for lunch, then you put it on after lunch, and then you take it off when you go home. That's 2 donnings and 2 doffings. And then you go to the next week, and so you can see how you can optimize, again, inspecting to make sure that it's not compromised and that the straps still give you that good tight fit, and that you do a seal check. With a used N95, one that you used before, you would have gloves on when you do your seal check to make sure that you don't contaminate your hands. There's another company that I want to share information with you about. It's called Battelle, and this is a link that is on your handout material as well. They have a free service, and this is through a grant where they're authorized to decontaminate N95 respirators. They'll mail you a box. They'll give you instructions on how to identify your N95 respirators. You mail it back to them. Again, they pay for shipping both ways, and then they'll use concentrated hydrogen peroxide vapor to gas the N95s for 2.5 hours. And so that is one strategy, and it's a free strategy. So you can contact Battelle, Battelle, and find out if this is a strategy that you might want to employ. You'll have to create a respiratory protection plan. I know it sounds ominous, but if you're going to be wearing respiratory protection, meaning N95s or even KN95s, you'll need to have a written respiratory protection plan. There is a checklist in the OSAP DentaQuest document that you can download the document and print the checklist to help you with all the steps on creating that respiratory protection plan. I'm actually working on one myself to put together for my clients. There's also the OSHA website. If you go to OSHA.gov publications, or just go to the OSHA website and type in respiratory protection toolkit, you can modify the toolkit that is used for hospitals. You can modify that for a dental toolkit. And this is actually where you can develop your written respiratory protection plan. Make sure that you keep the team comfortable and healthy when wearing all of this extra PPE. Stay hydrated. All the extra PPE may cause overheating. So drink a lot of water. Electrolyte drinks might help. When you're wearing N95 respirators, make sure that you avoid makeup or moisturizers, because that might compromise the N95s. And now we're going to switch over from PPE and quickly talk about disinfectants. We're getting close to the top of our hour, so I want to just remind you that disinfecting the surfaces is very, very important. Doorknobs and door handles and hard surfaces of furniture, restrooms, countertops. Our patients expect to see that. And when you're in the treatment area, you want to use an EPA registered hospital grade disinfectant, using the right product the right way, the right amount of time, and after every patient. You might be surprised how long viruses and bacteria can live outside their host. Influenza, 24 to 48 hours. Hepatitis B, 7 days. Hepatitis C, 6 weeks. HIV, which is a fragile virus, 6 days outside the body, but it loses most of its ability to infect within several hours. Herpes virus, 7 days. TB, 4 months. MRSA, methicillin-resistant Staph aureus, 7 months. And then COVID-19, 1 to 5 days. Now, COVID-19, or the SARS coronavirus, can live on surfaces: metal for 5 days, wood for 4 days, plastic and stainless steel 2 to 3 days, cardboard 24 hours, copper 4 hours, glass 5 days, ceramic 5 days, and paper up to 5 days. Now, what we can do is be very careful that we're using our disinfectants the right way. And I want to make sure that I review the decreasing resistance of organisms to germicidal agents with you, just to give you a good idea of what CDC's guidance are. So first of all, this is the 2003 guidelines. At the top of the chart, you'll see the word organism, and it starts at the top with the most difficult organism that we encounter in dentistry, which is bacterial spores. We need heat sterilization or cold sterile in order to deactivate or destruct bacterial spores. Then below that is mycobacteria. We need to have an EPA registered hospital grade disinfectant with a tuberculocidal kill claim. So that's considered an intermediate level disinfectant. It kills non-lipid and small viruses, as well as fungi, and also vegetative. Well, now we get to vegetative bacteria. So let me stop there and say, we could use a lower level disinfectant, an EPA registered hospital grade low level disinfectant. They're easier to kill and inactivate. And you see your Staph aureus and Pseudomonas aeruginosa and Salmonella. Then we go to lipid and medium-sized viruses. HIV and hepatitis are here, herpes virus is here. And looky here, look who's at the bottom of the list. Coronavirus. Now, this is coronavirus from SARS coronavirus, the first one in 2002 that they used this disinfectant chart, the resistance chart on. EPA, Environmental Protection Agency, has List N. You might have heard of List N, and it lists all the disinfectants that are effective against SARS-CoV-2. So there's your coronavirus. We want to make sure that we use the disinfectant the right way for the right amount of time, using disinfectant wipes, or if you're making a wipe with a paper towel and a spray disinfectant, you want to clean your surface first and then disinfect second. So having a clean surface is very, very important. Disinfectant doesn't do a very good job of penetrating debris and actually cleaning surfaces. Now, one thing I want to caution you against, please don't use 2x2s or 4x4s and soak them in your liquid disinfectant. Efficacy diminishes and the disinfectant can be deactivated by the components of the gauze. So please don't do this. If you want to douse a 2x2 or 4x4 at the time of use, that would be appropriate. But you know, paper towels are even more economical. I have here, this is a condiment container, and I could put liquid disinfectant, whatever my favorite brand is, that you can get plenty of the spray disinfectants or buy it by the gallon. I can put it in a container like this, properly label it, and then I can douse my 2x2 or 4x4 at the time of use. Also, be careful to always recap your containers. Make sure that you don't let that evaporate. The moisture evaporates, and then it also diminishes the effectiveness if a lot of your alcohol or other chemical ingredients have evaporated, then all you have left is water, and water doesn't disinfect anything. We want to make sure that we disinfect our surfaces so that we know we have left that disinfectant on the surface long enough. And for heaven's sakes, don't use household products in your clinical treatment area. You've got to use hospital grade disinfectants. You can't even find household products these days at the supermarket. The disinfectant wipes, every time I've looked, every time, and I've been looking since March, the shelf is empty. Now, there are disinfectant wipes that are sold by Clorox. They're the bleach germicidal wipe or the hydrogen peroxide wipe. You can get those from your dental dealer. Just remember that disinfectants have to be EPA registered as hospital grade products. Many times people ask me about hypochlorous acid, and there's a great article that was published last month in the Journal of Oral and Maxillofacial Surgery. I'm just going to give you the cliff notes of that. The pros, EPA registered as a surface disinfectant. So hydrochloric acid is a good surface disinfectant. It is effective against SARS-CoV-2. It's used in the food industry. It's used in wound care. It's inexpensive, and you can buy it commercially or you can make it on site, and it's a powerful oxidizing agent. However, the cons are that it does have some stability issues. The shelf life is affected by sunlight. The half-life increases with decreasing pH. It's less stable when it's exposed to UV light. So if you have UV light that you're using at your practice, that might diminish the efficacy. So make sure that hypochlorous, if you have it in a spray bottle, that you have that someplace away from the direct line of the UV light. And then sunlight, air, and temperatures over 77 degrees. The fogging process can also alter the physical and chemical properties of the disinfectant. There's lots of different machines that are available out there that you can use for fogging hypochlorous acid. But the ability of the sprayer to make smaller particles may help the solution's molecules be suspended in the air for a longer period of time because of their low settling velocity rate. This also may increase the solution's chance of coming into contact with pathogens and inactivating them. So if your fogger is used for hypochlorous acid, the aerosol size should be less than 20 nanometers. Micrometers. Now, FDA does not recommend spraying humans or with aerosolized disinfectant. We also want to make sure you understand there's currently no data to demonstrate that fogging people is effective in treating or reducing COVID-19. Surface disinfectants and sprays should not be used on humans or animals. They are not intended for that. They're intended for use on hard, non-porous surfaces. So spraying people with disinfectants is strongly discouraged by various health authorities around the globe because of their propensity for eye and skin irritation. You could have bronchial spasm following inhalation, gastrointestinal effects, and nausea, vomiting. There's all sorts of side effects. So we want to make sure that what we're doing, what we've done yesterday with infection control, that we really fine tune that today and make sure our protocols are appropriate. Tomorrow, we may find that things loosen up, or they may be just as stringent as they are today. The resources that I mentioned will be on a page that will be sent to you. And if it's okay, I know I'm at the top of the hour now. I'd like to address some of the questions that came in. Would that be all right? If so, someone has asked me, do you need to change gowns between patients? Ideally, yes. However, yes, go ahead. I thought I heard a chime in there.
Yeah, no, I'm good. I just want to make sure that we're really careful about the time because, with the ones that are staying over. So if we have to end it, I just want to make sure that we can answer the questions. We'll get to the questions, but we just want to make sure that we're respectful of people's time. So we're on the top of the hour.
So shall we go ahead and give the CE information now? And then would it be okay for me to stay on a couple of minutes for questions? And then those who want to stay can stay, or should we end it?
Well, the only thing is that the ones that don't stay on that still want the Q&A, will you send them the Q&A afterwards?
Yeah, we're going to send the Q&A out. We said we'd do that, I think.
Yeah, that's fine. Okay, so let's so guys, what we'll do right now is that if you need to go, we definitely will that will be the end. I want to make sure that we honor your hours. So we'll say this is it and thank you for joining us. And then if you can stay on, we'll let Leslie answer a few of the Q&A. So all right, go ahead, Leslie.
Are there any other codes or anything they need for CE verification before we go into questions?
No, Maria will take care of all that. So we're good to go.
Okay, so in responding to the gown, ideally, yes, change the gown. Hopefully it's a disposable gown that you can dispose of between patients when you perform aerosol generating procedures. If you're not performing aerosol generating procedures, perhaps you're a dentist and you're performing hygiene checks, then wearing the same gown or clinical jacket from patient to patient would be acceptable. Let's see, someone wanted to ask another question about the reception room. Are there any rules on what we can put out in the front office or in tables in the waiting room? Patients are asking where our Halloween decorations are. And following all the rules, they find it very hard to keep personal private practice image up. The patients expect upgraded service. Certainly they do. And you most certainly could put out some holiday decorations, but put them in no-touch surfaces and understand places where patients wouldn't have a cross-contamination issue. Will we ever go back to no face shield for hygienists? Well, again, hopefully we will be at a point where we can feel comfortable without a face shield when we find that there's less hazard. But at this point in time, I'm expecting, again, at least another year of protecting our eyes, nose, and mouth beyond just wearing the surgical face mask or N95 respirator. And then what do you do if an employer won't do an initial fit test? Well, again, remember, I would suggest that you provide information that you learned on this webinar to your employer and tell them you want the practice to be OSHA compliant. Is it okay to take off N95 respirators in between patients to breathe, or should we wear it 8 hours straight? Oh my goodness, for heaven's sakes, take breathing breaks when you need them. But know that each time that you take it off and put it on, that it might be slightly compromised, less. So again, they're only single-use disposable items. So if you did take them off for breathing breaks, be mindful when you put them back on that you are inspecting it to see if there's any visible. Will UV light ruin the respirator? We use UV light to disinfect it. There's no evidence that provided in the CDC guidance for the UV on N95 respirators. It inactivates the virus, but it has to be at a certain level of UV. So you need to make sure that the UV that you're using is the right level, and also that you're not exposed to the UV light when you're using it, because that can be damaging to your skin, carcinogenic, and damaging to your eyes. Someone asked a question about SonoMask. I'm not familiar with that. Someone used Battelle and they threw away about half of the masks sent in. That's true. If the masks are compromised or they have makeup on them or otherwise are not appropriate for decontaminating, then they won't decontaminate them. And then CDC doesn't advocate a Battelle system for respirators. Again, we don't want to reuse something 20 times if it's going to be weakened in how it fits our face. So I think we've got great information that people have contributed, questions that were asked. I don't see any other questions. And again, honoring people's time frame, I think we're ready to close the program down.
Well, thank you so much, Leslie. And I will say this, you know, I know you do a lot of classes and trainings too that we couldn't go over. So we'll definitely send those out in the brochure. So if your office is looking for some training, you know, I would highly recommend Leslie's got you got some awesome webinars and stuff that we can do. So thank you for all your time that you do. I mean, I just think we have you on every quarter. I just think that it's changing so much. I was saying on a live webinar today that you don't even send your PowerPoint to us until Monday for a Wednesday because it's constantly changing. So thank you for staying on top of all that and keeping us informed. We really appreciate it. So guys, go ahead, Alyssa, let's go ahead and switch the slides. So make sure, please scan this QR code. It will give you our upcoming webinars. We definitely want to make sure that you're on them. So all you got to do is hold your phone up, scan it, and you will see some of the upcoming ones. Go ahead, Alyssa. And so we have 2 workshops coming up. One of them is going to be on radiology. We got a lot of requests for people who have their radiology license, but they need a renewal course. So we're going to be having a renewal course for a 2-hour renewal. It's going to be November the 13th, and it's going to be from 1 to 3. So if you are looking for a course for renewal, not to license, but to renew your X-ray license, please sign up for this course. And also, I will be doing a course with Linda Anderson, one of our business coaches, on the end of the year, what we should do, what we should look for, how do we close out our year, and then how do we reset and re-engage for 2021. You're not going to want to miss this workshop. It's limited to 50 people. So please make sure you sign up. Whether you're new, been doing it for a long time, I'm sure you're going to get a lot out of it. We are limiting the seats to 50. So please, it's going to be December the 4th, and it's going to be from 1 to 3. So please join me for that. Again, thank you very much, and thank you for coming on tonight. If you have any questions, this is the email address I was telling you about earlier. It's practicecoaching@benco.com. We would love to get your feedback. We would love to know your questions. What would you like to see more of? We're here for you. Leslie, thank you again. An amazing webinar, like you always do. And I'm sure we'll have you back probably in another 2 months or so to give us some more updates. You did a great job. Have a good evening, everyone, and enjoy your dinner. Bye-bye.
Bye-bye.